Hello, my name is Paulina, and I did my analysis on the Graduate Driver Licensing Evidence-Based Program. Motor vehicle incidents are a leading cause of death in the U.S., young drivers being particularly at risk due to the inexperience and immaturity. In 2003, 58.1 fatalities per 100,000 drivers resulted in motor vehicle incidents involving teenage drivers 16 to 20 years old. Due to the high levels of motor vehicle accidents involving teen drivers, as early as the 1990s, many U.S. states began altering the licensing system targeting teen drivers to address the high rates crashes which occurred during the first 2 to 3 years of driving. As of today, the GDL program has been implemented by most states. The purpose of the program is to alter the way young drivers are introduced to the driving and to provide young drivers the opportunity to gain experience and control risky situations before driving on their own. Even though most states have implemented the GDL program, the overall structure and components vary by state. However, most programs have the following components and similarity. A supervised learning period, having an experienced driver monitor the driving of the teenage driver for a specified period of time or after a set of accumulated hours, whichever one comes first. 2. Unsupervised driving hours during a specific time of day, also simultaneously limiting the age and number of passengers while the teenager is the driver. Number 3, once initial stages have been passed and signed off by the parents, a young driver becomes fully licensed. Although most GDL programs have been successful, there are some that have seen little or no change in the overall crash rates among young drivers. The difference in results among rates are associated by various health determinants that affect the overall outcome of the GDL program, respectively. These health determinants can vary from a socioeconomic status to parental involvement and many more. Based on the information that I have read, a question that comes to mind is what is the overall sustainability of the program over the years, and what other components should be considered for a successful outcome of the GDL program across states? Determinants affecting the motor vehicle prevention programs can range from previously established state laws, urban versus rural living, traffic density, alcohol consumption, zero tolerance laws, as well as the socioeconomic status of the driver. As mentioned above, one of the determinants to a successful program is the socioeconomic status of the driver population being targeted, in most cases, young drivers. According to Morrissey et al., studies indicate the fatalities among 16 to 17-year-old drivers decrease by 3.3 to 6.2% when there is a 10% increase in gasoline prices. The correlation between the reduction in motor vehicle fatalities and gas price increase indicates that teens have a lower exposure risks to motor incidents because they tend to be less on the road. Since most teens at that age can't afford to pay for gas, they must reduce their driving. This reduction in driving can have positive outcome on GDL programs or vice versa if the gas prices decrease. Gas prices are also an underlying socioeconomic status issue, indicating that some populations have to choose between having the ability of driving or being able to provide food for their family, therefore affecting the overall program outcomes. Another social determining affecting affecting GDL outcome is the alcohol consumption among teens, which associates with zero tolerance law, implemented in some states. According to Mori and Grabowski's, in 1994, 13.9% of motor vehicle incidents involved 15 to 16-year-olds, while 27.1% of fatal alcohol-related incidents involved 18 to 20 years old. Due to such high incident reports, some states acted by creating the zero-tolerance law among teens. Some other states have not established such laws and therefore have decided to implement the GDL program. The alcohol consumption is an underlying determinant of the social behaviors among teens and culture of the state. For those states that have not implemented the zero-tolerance law or have no GDL program, they need to look at how they can change the culture of the state and community relating to underage drinking. Although the GDL program has been successful, there is still more that needs to be done First of all, teen drivers are a diverse group from different backgrounds. As of today, I have not been able to find information on how the program is targeting non-English speakers. If the program were to target non-English speakers, young drivers, they would also have to consider how the information will get to the parents if they play such a big role in their kids' life. Also, for most young people, the opinion of the peers is crucial. The GDL program could be promoted in ways that affects the overall opinion of friends. For example, the program could be made into a coming-of-age status symbol, encouraging teens to want to participate in the program as a symbol of becoming an adult. This program could also be promoted through parental education, sharing with parents the statistics prior to implementation of the program and post-implementation. Finally, to get the community involved, the program could also be promoted through the different high schools and through various youth programs. Infrastructure. The implementation and development of the graduated driver licensing program dates back to the early 1970s, after New Zealand had successfully implemented the program. The National Highway Traffic Administration developed a GDA model in 1972. The model was implemented two decades later after enough evidence demonstrated positive outcomes. After decades of unsuccessful implementation, the GDL program became a crucial component of driving education among teen drivers. Over the past 2 decades, the Institute of Highway Safety and the NHTA have become key players in the development and implementation of the GDL program. Other key players to the implementation of this program are state officials, policy development, and overall support of the GDL. There are many public health professionals that are part of each of the key stakeholders working together to develop the effective GDL program. Overall, the role of each key stakeholder is to promote the effectiveness of the GDL in reducing teen driver accidents while simultaneously providing a self-learning environment for teens. Aside from having internal stakeholders, there are also external stakeholders who contribute to the development of the program. These external stakeholders consist of commercial sectors that develop programs to further develop teens' driving skills. Commercial sectors contribute to the program development with funding resources. At the same time, they are able to develop computer-based driving tutorials which can be sold to the targeted population. Commercial sectors might collect data used in the future to improve driver education. By allowing commercial sectors to be involved in the program, a symbiotic relationship is formed between each group. The organization is able to receive funding of the project, and they are able to provide computer-based learning experiences. As for the commercial sectors, they are able to profit from their computer-based programs and any other commercial driver education they may have developed. Even though there are many organizations involved, most of the data collected to report on the success of the program comes from from state motor vehicle incident databases. Most of the evidence-based research associated with the GDL program have been obtained from accessing the Fatality Analysis Report System, FARS, to understand accident trends. Many of the research that examines the effectiveness of the GDL program must look at the State Motor Vehicle Data Report to effectively study the trends pre- and post-GDL implementation. Using these resources has allowed for different states to prove the effectiveness of the program in other states looking to implement GDL. Initial funding for the development Initial funding for the development GDL program came from the state funding, but over time, funding has come from different organizations. Some of the national organizations include the IIHS or the NHS. Commercial funding also contributes to continuation of the programs, and most of the GDL programs are replacing guidelines for teens already in effect. The amount spent on it or necessary to run the program is minimal. Most of the funding that is received is used to continue the research. Allowing the continuation of research, groups are able to determine which component of the GDL is more effective than the other. This comparison might lead to the ideal program development that could be used by all states and guarantee a successful outcome. After careful analysis of the implementation, the GDL program, I believe the program should be funded by the state and by federal organizations. The implementation of the GDL benefits all residents every state, and the program is only replacing something that already exists. If the commercial sector is looking to profit from the GDL program, then they should also be required to provide funding and to share the data collected in order to see the progression of the program. Before becoming a successful program in the US, the GDL became a popular system in New Zealand and other countries. If I were to implement a licensing program to reduce teen drivers being involved in fatal motor accidents, I would use the data in order to demonstrate the effectiveness of the program. Statistics and proven results is one of the things that assist in making GDL successful. Aside from offering statistical numbers, I would promote the program towards parents who would be interested in helping their young drivers gain experience before becoming licensed drivers. Additionally, I would ask for the program to be part of the driving education in school and advertise as a positive course to take. Finally, in order to make the program more appealing to teen drivers, I would find a way to promote it as the it among teens. Peer approval is a crucial concept. By making the program as something cool, this might encourage other teens to accomplish every stage of the program. Over the years, the GDL program has raised many political issues and ethical concerns, which have contributed to the development and implementation of the program. The development of the program rose from an essential ethical issue, a high percentage of teens being involved in fatal motor vehicle accidents. In an effort to minimize car accidents, many driving programs have been developed since the early 1940s. Unfortunately, over time, these programs have become less and less effective and ultimately do not prevent teen car accidents. In an effort to continue preventing fatal motor vehicle involving teens, the Graduated Driver License Program was developed and implemented. The program gained popularity in the United States after enough evidence had demonstrated the effectiveness of the program. Another ethical issue addressed by the program is the lack of experience most teen drivers have in the early years of obtaining their driver's license. Even though 13 states have implemented the GDL program, the components of the program in each state are very different from each other. These differences make it difficult to gather data for comparison over the years. Also, political issues arise due to the difficult requirements of each state. Over the years, different states have been revising the components of the program, making improvements, adding more restrictions to further decrease fatal motor vehicle accidents. Aside from the GDL creating political issues, which ultimately helped the development and implementation, there were also social, economical, and political factors. As previously mentioned, one of the major reasons his program was implemented was to reduce the number of fatal motor vehicle accidents involving teen drivers. This would be considered a social factor. The other reason consisted of providing opportunities for drivers to gain more experience. The implementation of the GDL program allowed for the state to be implement more restrictions, which would decrease the number of fatal accidents. This would be considered a political factor contributing to the need. Just like any new program, there were groups who opposed the implementation. One of the reasons for the opposition was the lack of evidence and the effectiveness of the program. Many people believed the GDL would have the same fate as the other driver education programs. Over time, after New Zealand and Canada implemented the program, collected data demonstrating an effective result, the US decided to implement the program. Another possible opposition could be parents who believe not to have the time to monitor teens' driver hours. This, of course, is only a hypothesis. I was not able to find information on the subject. As outlined above, there are many reasons for the GDL program was designed and implemented. Some groups might oppose to the effectiveness, but overall the program has decreased fatal motor vehicle accidents among teens. This evidence in itself can be a positive ethical issue. Conclusion: the GDL program successfully only after research demonstrated the effectiveness of the program. Research was able to demonstrate that night restriction on night driving greatly decreased teenage crashes. Research also demonstrated the increase in teenage driver accidents when transported teenage drivers. Based on the research data, parents of teenage drivers strongly accepted the GDL. Over time, each state has implemented different versions of the GDL program containing main components as outlined in the introduction. With the GDL program, there seems to be more positive long-term effects than negative short-terms. First of all, one of the long-term effects is the reduction of motor vehicle incidents involving teen drivers. Because of the GDL program, restriction driving times and passengers can be transported. The GDL program also provides an opportunity for teen drivers to gain experience in a controlled environment before being on their own. This is a long-term effect because ultimately they will become better drivers. As far as the quality of life, GDL it helps to improve the lives of teenage drivers and their family members because teens are able to gain experience. It allows for them to have longer lives without the risk of getting into car accidents. This program also provides a better quality of life for parents who are able to monitor programs of the teen drivers. Even though the GDL program tries to target specific factors, there still remain issues affected by the GDL program.